Hi, I'm Evan, and our quality improvement project was focused on promoting yearly wellness exams to prevent non communicable diseases. In Kansas, these diseases, like heart disease, diabetes, and cancer, represent a considerable health burden. The Kansas Department of Health and Environment published health statistics and vital records that show how important early detection and preventive care are for improving outcomes. However, a large portion of adults, especially those between the ages of 18 and 65, do not participate in yearly wellness exams due to barriers such as cost, limited access to care, and low health literacy. Many of these diseases develop gradually and are driven by modifiable risk factors. For example, high blood pressure, elevated blood sugar or cholesterol, obesity, lack of physical activity, poor diet, and tobacco use. Yet many people may not engage in routine annual health checkups that can help detect those risk factors early while intervention is most effective. This lack of regular preventative care often leads to delayed diagnosis, higher treatment costs, and more severe disease progression. According to the National Center for Health Statistics, annual physical exam attendance among adults declined in recent years, highlighting a clear gap in preventative health engagement. To address this, the Quality Improvement Project we chose focuses on promoting yearly physical wellness exams as a proactive strategy to prevent and detect non communicable diseases early. Putting this all together in our community and aligned with statewide trends, there is a quality improvement opportunity to promote and increase yearly physicals among the targeted health population of adults, which leads to better detecting risk factors for these diseases, managing them early, reducing the incidence or severity of these diseases, and improving population health. The aim statement of this quality improvement project is to increase the percentage of adults aged 18 to 65 completing an annual physical or wellness exam from 45% to 70% within 12 months through the Kansas Department of Health and Environment. The project will target individuals who have not completed a physical in the last year by using patient reminders, education on preventative health benefits, and improved scheduling access for patients who may lack the technology or ability to schedule an appointment easily. According to the Centers for Medicare and Medicaid Services, annual wellness exams are essential for identifying health risks and supporting early interventions to prevent chronic diseases.
Today, I'll be talking about our quality improvement project focused on increasing participation in yearly physicals and wellness exams and improving early identification and prevention of diabetes and other chronic diseases using the PDSA cycle. To begin, this project involves a multidisciplinary team. The Quality Improvement Coordinator serves as the project lead, overseeing planning, implementation, and evaluation. Our clinical staff, including primary care physicians, nurse practitioners, physician assistants, and registered nurses, play a key role in identifying at-risk patients, completing screenings, educating patients, and reinforcing follow-up care. A certified diabetes educator and dietitian provides specialized support by guiding patients on nutrition, lifestyle changes, and blood sugar management. Support staff, such as medical assistants and health information management specialists, help with scheduling vital collection, documentation, and tracking wellness visits, compliance in the electronic health record. From leadership, the clinic manager and chief medical officer ensure project alignment with organizational goals and promote provider engagement. Patient advocates and community health workers help us understand barriers to care and support culturally sensitive outreach. Finally, the IT and data analytics team monitors our metrics for wellness visit completion and diabetes risk factors. Our strategy follows the PDSA model. For the plan, we begin by identifying patients overdue for wellness visits, our screenings using EHR data, educational materials on prevention, nutrition, and physical activity are shared during visits through the patient portal and in waiting areas. Staff are trained to deliver consistent messaging and support patient engagement. Do. In the pilot phase, one clinic will initiate the intervention. Nurses and medical assistants will conduct outreach via phone calls and portal reminders to encourage scheduling. Providers will discuss risk factors and document screenings during visits. Baseline data will be collected on exam and screening rates. Study. After 3 months, we'll review data to measure improvements in wellness visit completion, diabetes screenings, and any new diagnoses. Feedback from both staff and patients will help us evaluate what worked and where adjustments are needed. Act. Successful strategies such as personalized reminders or EHR prompts will be refined and expanded to additional clinics. We will continue to use PDSA cycles for ongoing improvement and sustainability. In summary, this collaborative approach aims to increase preventative care participation, promote early identification of diabetes, and improve long-term health outcomes by leveraging teamwork, data-driven decision-making, and continuous improvement. We can create lasting impact across our patient population.
When developing our quality improvement project, our team wanted to focus on lowering non-communicable diseases through preventative healthcare measures. Rates of non-communicable diseases are consistently rising due to various factors both in and out of our control as providers. Insurance costs, rising provider expenses, food quality, and work-life balance are all contributing to the rising increase of NCDs. Addressing our HCO was vital to improving annual wellness exams as providers are responsible in the treatment and diagnosis of non-communicable diseases. Using a fishbone diagram, we were able to pinpoint areas where we thought things were lacking. We wanted to improve patient monitoring, making sure that we are keeping track with patients that are due or overdue for their annual wellness exam. We also wanted to prioritize early warning signs and making sure that our providers are educating patients and making sure that patients understand the risks of these conditions developing further. If we see patients are starting to show warning signs such as prediabetes, we want to do everything we can to keep them from developing type 2 diabetes, as that can complicate things even further later on. By monitoring patients, prioritizing education and communication, we are able to lower the rates of non-communicable diseases by 20%. With preventative measures and communication, the U.S. could save upwards of $45 billion annually rather than the $1.5 trillion we currently spend just on non-communicable disease management alone.
At the top, you'll see some of the key improvements we noticed in 2025, and these results really highlight the impact of our project. We started catching diseases earlier, which is a plus. People became more aware of their own health. We saw more preventative screenings getting done, and patients were using digital tools such as reminders and portal messages more consistently. All of that helped strengthen engagement and made preventative care a lot more accessible. Looking at the graph titled Percentage of Patients that Received an Annual Wellness Exam, this shows the progress visually. You can see a clear upward trend as we move through the year. The combination of outreach, education, and better follow-up directly contributed to this increase. It's a simple graph, but it represents real change with more people coming in for wellness exams and more opportunities to catch risk factors early. Moving into the lessons learned and next steps, we are building strategies into routine practices so they become part of everyday clinic operations. We're also making ongoing staff training a priority so the whole team stays aligned. We are keeping patient and community education consistent because informed patients are more likely to stay on top of their health. We will be monitoring the data continuously so we can keep improving and adjusting. Leadership will stay involved to support resources. Once the process is working smoothly, we plan to expand it to other clinics so that more communities benefit. The goal is to keep the positive results going, more preventative care a normal part of adulthood, and keep improving the health of people across Kansas. This project proved that when we engage patients early and regularly, we see significant change.
In conclusion, we discovered that regular data tracking is crucial for effectively monitoring progress. Possible obstacles to this project can be former and incorrect patient contact details, limited staff availability, and minimal awareness of preventative health care. In spite of these obstacles, the initiative can attain significant accomplishments, including better scheduling of wellness exams, improved screening rates for non-communicable disease risk factors, better collaboration among staff, and earlier detection of high-risk patients. Our team is planning to develop new strategies of marketing to the Kansas labor workforce, collaborating with companies that incentivize their employees to keep up with annual care. Prevention of disease is more cost-effective and leads to better health outcomes for all patients.